أعوذ بالله الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. So in our lesson today we shall be talking about the social determinants of health and health equity. So this will be our lesson's objectives. That is, by the end of the lesson, the learner should be able to do what? Number one, define social determinants of health and explain how factors such as education, income, and environment influence individual and population health. Number two, differentiate between health equity and inequity, inequality, and disparity, and describe their implication for health care systems and policy. Number three, identify examples of health disparities and analyze their causes, including systemic racism, economic barriers, and geographic limitations. Then compare and contrast healthcare access challenges faced by rural and urban populations. Then lastly, explore the practical strategies to improve access to healthcare. So these will be our lessons, our lesson objectives. Now, so number one is to define what is or what do we mean by the word social determinants of health. So, social determinants of health are the conditions in which people are born, grow, live, work, and age, and they significantly affect a wide range of health outcomes. So, this is the brief definition of what? The social determinants of health. So, it's basically where you are born, the living condition, the environment in which you are born, the environment in which you grow in, the environment in which you live, work, and age, and how this environment significantly affect your health. So these factors, which are the social determinants, shape a person's ability to live a healthy life and have a major influence on health equity. So health equity, on the other hand, is what? Is the principle of ensuring that all individuals have the opportunity to attain their full health potential, regardless of their social, economic, or demographic factors. So that is the definition of what? Of health equity. That is, all the people in the society, all the people in the country, they have equal access to health opportunities. Now, understanding the social determinants of health. So the social determinants of health are often grouped into several categories, including education, employment, environment, social networks, and healthcare access. And these factors, they normally interact with each other and can either promote health or contribute to health inequities. So these factors here, they can either promote, as we shall see. So number one is about education. So when you're talking about education, education is a key social determinant of health. It influences health behaviors, employment opportunities, income, and access to resources. Higher level of education are typically associated with better health outcomes. So people who are well educated, then they are well equipped with skills and they are aware of how to keep themselves healthy. So what is the impact of education on health? So education provides individuals with what? The skills and knowledge to make informed health choices. So for example, sometimes you find people are smoking or people are eating rats. And maybe it's because they are very informed, they're not educated, they don't know the effect of maybe smoking cigarette. But an educated person can make an informed decision not to smoke. Number two, those with higher education levels are more likely to have better jobs, higher incomes, and live in healthier environment, which in turn promote better health. So people who are well educated, of course, Most of them, they have good jobs. And if you have good jobs, you're going to get a good income. And if you have a good income, then you're going to do what? You are going to live in a place that is what? That is good. So a study, for example, a study by the Centers for Disease Control and Prevention shows that people with higher education level are less likely to engage in risky behaviors such as smoking and unhealthy eating habits. They are also more likely to seek medical advice and follow prescribed treatment. So that is the importance of having education and how it is correlated to what? To positive health outcomes. But sometimes you find there are barriers to education. So low educational attainment can limit access to health information. If you are ignorant, then you cannot get enough information about health. And health literacy, leading to poorer health outcomes. For example, a person with limited education may not understand the importance of preventive care, such as vaccination or cancer screening, potentially resulting in worse health outcomes. Number two is employment and working conditions. So when you're talking about employment, this is all about the employment status. Where do you work? The quality of work and working conditions such as wages. How much are you paid? Job security. Are you secured in your job? And the work environment. So all these significantly impact health, employment, and can provide income, health benefits, social status, and a sense of purpose. So what is the impact of employment on health? Having stable, well-paying employment often improves access to health. If you're working in Telesom, if you're working in a good company, you get good money. So you can easily get access to healthcare, reduces stress, and also enhances mental and physical health. Number two, unemployment or precarious work condition, e.g., temporary jobs and safe working condition, can increase stress, lower self-esteem, and increase the risk of chronic diseases. An example is people with full-time employment often have access to employer-sponsored health insurance, which improves their ability to afford medical care. Some people, their company normally insure them. So when they're sick, the company is going to pay for the medical bills. And like conversely, the opposite, individuals working in precarious means pathetic working conditions or low-wage jobs, people who are cleaners, people who don't get enough money, may lack health benefits. So this will increase the likelihood of them not doing what? Foregoing necessary medical treatments. So what are the barriers? Unemployment and underemployment and poor working condition can lead to economic stress, poor mental health, and higher exposure to occupational hazard, for example, toxic substances and physical strain. For example, factory workers exposed, there are some people who normally work in factories and they are exposed to hazardous materials, chemicals. So they may suffer from long-term respiratory conditions or other chronic illnesses due to unsafe working conditions. So there are some people who work in companies or industries where they're exposed to a lot of chemicals. And these chemicals in the long run can affect them with chronic diseases, for example, TB and other respiratory diseases. Physical environment is another social determinant. So the physical environment, including housing, neighborhood, the air quality, and access to clean water, is a crucial determinant of health. Living in a clean, safe, and supportive environment is essential for good health. So what is the impact of this physical environment? So for example, poor living condition. There are some people who live in what? In overcrowded housing, where there is no enough space, people are close to each other. Exposure to pollutants. You are living to a place where there is water pollution, air pollution, unsafe streets, for example, are associated with a higher risk of chronic diseases. mental health problems and injuries. But the opposite is true. Access to green spaces, parks, and recreational areas encourages physical activity and contributes to better mental health. So, for example, people living in neighborhoods with higher pollution levels, e.g., industrial zones, are at a higher risk of respiratory disease, cardiovascular diseases, and even cancer due to the long-term exposure to harmful environmental factors. So there are some people who normally live near factories and industries, and that environment is very toxic. In the long run, they might be they might be exposed to respiratory diseases. So what are the barriers? Environmental factors such as poor air quality, lack of sanitization, and unsafe housing can increase the likelihood of illness and disability, particularly in low-income neighborhoods. For example, in urban areas with limited access to green spaces, people may have fewer opportunities to physical exercises, leading to higher rates of obesity, diabetes, and cardiovascular diseases. So people who normally live in town, because the town is overcrowded, people are building shops, business centers every day, and because of that, you might lack space to even train, which in the long run can be detrimental. Social network and social support. Social networks and support systems such as family, friends, and community ties play an important role in mental health, physical health, and overall well-being. A strong social support system can do what? Can enhance an individual's ability to manage stress and at the same time cope with illness. So what is the impact of this social network on your health? So social isolation. Isolation means you are very far from your family. You are very far from your friends. So social isolation and lack of support are associated with what? With poor health outcomes, such as depression, anxiety, and even premature mortality. You'll die when you're young. So you always need to have a family around you, friends around you. On the other hand, social connectedness, if you're connected to people, you live with your family, this one can enhance mental and emotional well-being. It can also promote healthy behaviors and provide resources to navigate the healthcare system. For example, a person with a strong support system of family and friends may be more likely to engage in regular physical activity, follow health advice, and seek medical care when needed. Conversely, meaning the opposite, social isolation can lead to depression and neglect of personal health. Now, sometimes the lack of social support, especially among elderly or marginalized groups, can increase vulnerability to mental health problems and negatively affect overall health. So you have many societies where when people get old, they are isolated, they're neglected, especially if you go to the Western countries like America, the UK. So even they normally isolate their parents because they are very old. So they think that they are a problem, they are burden. So they cannot even give their parents the necessary social support. But unlike us, the Muslims, what normally happens is that we are very close to our parents, even if they're very old, and these, like, the more close we are to them, the more support they feel, and as such, they're not going to be depressed. So, for example, elderly individuals living alone may experience loneliness and isolation, leading to mental health such as depression and anxiety, which can in turn affect their physical health because they're going to be drained. Then lastly, there is what is known as health access. So, access to healthcare refers to what? It refers to the ability of individuals to obtain necessary healthcare services when needed. Like anytime you want to go to a hospital, then you can easily go. So this includes the availability of healthcare providers. That is, in your area, are there enough doctors, enough nurses? Affordability of services. Yes, they might be there, the services, but are they cost effective? And the quality of care, is it good? Yesterday, you were talking about the issues related to quality. And lastly, the accessibility of health facilities. Are they close to you or far? Now, what is the impact of accessibility? Access to healthcare plays a pivotal role in the prevention, diagnosis, and treatment of diseases. It ensures that people can receive the care they need, improving both their physical and mental health. Lack of access to healthcare can lead to what? Untreated condition, higher morbidity rates, and even death. For example, people with health insurance and access to regular health providers are more likely to receive preventive care, e.g., vaccines, screening, and treatment for chronic conditions, e.g., hypertension, diabetes. And this will improving long-term health outcomes. So what are the barriers? Sometimes some people, they don't have access to what? To the healthcare. So barriers to healthcare access include geographic location. Maybe the hospitals are very far. Insurance coverage, maybe you don't have enough health insurance. Affordability, maybe you don't have enough money. Language barrier, sometimes you go to the hospital, but you cannot. There is a language barrier. You cannot speak to. They cannot understand you, the health professionals. And sometimes there is discrimination within the healthcare system. So, for example, rural communities with limited healthcare facilities may face challenges accessing essential health services, leading to poorer health outcomes, particularly for conditions that require specialized care or emergency services. Now, on to the next part of our lesson. It's all about what is health equity, health inequity, health inequality, and health disparity. So, understanding these terms, the health equity, health inequity, health inequality, and health disparity, is critical in addressing the root causes of poor health outcomes and in designing policies and intervention to ensure everyone has a fair opportunity to achieve optimal health. So these concepts are essential in understanding global and national health systems and the social determinants of health. So number one, health equity. What is the meaning of health equity? So health equity refers to the principle of ensuring that all, so the key word is all individuals have a fair opportunity to attain their full health potential, regardless of their social economic background, regardless of their gender, race, or other social factors. So it means reducing and ultimately eliminating disparities in health and healthcare access, ensuring that resources are allocated based on need and promoting fairness in health outcomes. So in a nutshell, what they're basically trying to tell us, when we are talking about health equity, we are basically talking about putting systems that will ensure that everybody in the society gets what? Gets the necessary health care. What is the goal of health equity? The goal of health equity is to do what? Is to create systems that are inclusive. This word is very important. Inclusive and fair. That is where everyone has access to the same opportunities to be healthy, regardless of where they come from, regardless of their demographic circumstances. So, for example, many governments, they have implemented what is known as the universal health access or the universal health coverage. So the universal health access, so that everyone, regardless of their income, has access to essential health services and preventive care. Many countries, they have what is known as the universal health coverage, where the government is the one that is paying for the what? Is the one that is paying for the health fee for the citizens. Or sometimes, if it is not paying, it is putting systems in place to ensure that at least the citizens can get good quality services at good prices or good fee. Number two, health inequity. This is the opposite of what you are talking about. So health inequity refers to what? It refers to the presence of unfair and avoidable differences. So avoidable differences meaning that there are some differences. The system is the one that is making the difficulty or the barrier in health status or health access across different population or groups. It occurs, so health inequity occurs when certain individuals or communities are systematically disadvantaged. Why? Due to factors such as socioeconomic status, race, or geography. And these disparities are unjust and can be addressed through policy and systematic change. So they are very unjust. So what we need to do is to always ensure that the government has to put in place policies, structures that will reduce the inequity. What are the causes of inequity? So health inequities are often rooted in social, economic, and environmental conditions, such as poverty, lack of enough education, lack of good housing, and sometimes maybe if you're not employed, which disproportionately affect marginalized population. So, for example, an individual living in a low-income neighborhood may face difficulties accessing healthy food, exercise opportunities, or quality healthcare, leading to worse health outcomes compared to someone in a more affluent area. Affluent area means somebody in a place that the neighborhood is very good. It has the necessary space, well ventilated, good drainage system, ila ghairi dhalik. Health inequality. So what is health inequality? It refers to differences in health status or health outcomes between different individuals or groups. So this is very important. While inequality simply acknowledges that there are differences in health, it does not necessarily imply that those differences are unfair or avoidable. So sometimes inequality means, yeah, there are some difference. But this difference does not mean that there is some, it does not mean that there is some inequity, no. So for example, health inequalities can be due to factors such as biology, genetics, life choices, or environmental exposures. So for example, there are some people, they have been born, they are tall, and some people are short. So this is inequality, but it is not inequity. So I am tall, yes, and you are short. So this is something that it is natural. So there is no problem with that. Sometimes there is life choices. You know, some people, they go to the gym. Some people, they don't go to the gym. So you cannot say there is inequity, no, because somebody is taking good care of him or herself. But for you, you don't go to the gym. So this is a life choice. So you cannot say now it's unfair. No, it's not unfair. You know? Or sometimes the environmental exposure. Where so sometimes I live in a good place and you just decide you are not living in a good place. You have the money, but you don't care about yourself. So look at this example. A person who smokes and lives an inactive lifestyle may experience health inequalities, such as higher risk for heart disease. Somebody is smoking. You're not eating balanced diet food. You are eating a lot of junk food. You'll get heart diseases. Compared to someone who engages in regular physical activity and doesn't smoke. There is somebody who does not smoke. Somebody is always training. So these inequalities might be influenced by personal behavior rather than social structure. So the inequality, it's all about personal behavior. It is not about the systems that are in place. No, it's you. You are the cause. So the key point is that health inequality does not necessarily imply injustice or unfairness. So some differences in health outcomes are natural. You are born like we were born differently, or inevitable, unavoidable, and do not involve systemic discrimination. So this is very important because sometimes in an exam you can be asked the difference between health inequality and health inequity. So you have to know the difference. Number 4, health disparity. Disparity is another word for difference. So health disparity refers to differences in health outcomes that are closely linked with social, economic, and or environmental disadvantages. So these disparities typically affect certain populations more than others, and they are often preventable. So health disparity is related to what? Health inequity. So health disparity can result from unequal access to resources. Some people, they have access to resources, and some people, they don't have access to resources. Sometimes it's just discrimination. Maybe gender-wise, the male, they are preferred than the female, or maybe because of my color, or sometimes it can be structural inequalities. So for example, African Americans, Latinos, and indigenous population in the United States are more likely to suffer from chronic diseases such as hypertension, diabetes, and obesity compared to white populations, often due to systemic barriers to access to health care, economic opportunities, and healthy living environment. So in America, for example, the African Americans, they normally find it very difficult as compared to what? To the white Americans. They find it difficult to access health. Maybe because of discrimination, maybe because of they don't have enough economic opportunities, and maybe because most of them, they normally live in the slum areas. Now, health disparities and inequities. We normally have what is known as geographical, racial, economic, and gender disparity in health. So all these, for example, when we talk about geographical disparities, so there's geographical health disparity refers to differences in health outcomes based on location where individual lives, such as rural versus urban. So in rural areas, they face a lot of challenges because they don't have enough healthcare providers, or the distance also. But in urban areas, in towns, sometimes, of course, they have their own challenges, overcrowded, inadequate access, ila ghairi dhalik. So sometimes the differences is based on location. Number 2, the difference can be based on your color, racial. Racial health disparity refers to differences in health outcomes among different racial or ethnic groups. Sometimes because I'm from this clan and I'm not from this clan, so I cannot get the privilege. Sometimes it is based on, it is known as systemic racism. Like racial minorities may face discrimination within healthcare system. There are some groups that are preferred, some tribes that don't have the numbers, they cannot get the services. Number 3, economic disparities. Economic disparities means there are some people who have money, there are some people who don't have money. Some people, they work, they get good salary, they can take good care of themselves. Sometimes some people, they're very poor, they don't work, they cannot afford. So that is the meaning of what? Economic disparity. Gender disparity. Gender disparity basically means that there is a difference in what? in health outcomes and access between the men and women. So sometimes women may face gender-based discrimination in healthcare, lower level of access to reproductive health services, and higher rates of gender-specific diseases such as breast cancer and maternal health. Sometimes even men, particularly from disadvantaged groups, may have lower life expectancy, higher rates of occupational. So when you're talking about gender disparity, it's all about the what? The rate of accessibility of men compared to women. Now, what is the meaning of rural healthcare access? Of course, we know that rural healthcare access refers to the ability of individuals in rural or remote areas to access necessary health services, including preventive, diagnostic, and treatment services. But rural areas are often characterized by lower population density, fewer healthcare facilities, and greater geographical distances to health services. So all these are barriers too. So challenges of healthcare in rural areas. So if you go to rural areas, number one, they have limited health facilities. They don't have enough hospital. The distance and transportation, you have to travel for long distance. Healthcare provider shortage, you don't have enough doctors, you know, and also you don't have emergency services. Sometimes the emergency services can take a long period of time before it comes. So these are some of the challenges. So it is the opposite of the urban healthcare. So in urban healthcare, access refers to the availability and ease with which individuals in urban areas can obtain healthcare services. Urban areas are typically characterized by higher population density, more health, of course, more health facilities in towns, and a wider range of healthcare providers. If you go to towns, you'll always find there are what? They have a higher range of healthcare providers. So the advantages of towns or urban, they have availability of healthcare facilities, many of them, better access to specialists, the doctors, the nurses, the cardiologists, the opticians, you know, the pediatrics, shorter wait times. They don't have to wait a lot because there are many hospitals and emergency services are easily available. You just call an ambulance and within some few minutes, the ambulance is at your doorstep. But what are the challenges in urban healthcare? So they are overcrowded and strain on resources. So due to there is many people live in town. So this overpopulation sometimes can lead to what? Long wait time. People have to wait for long period of time. Then there is also health inequities in urban areas. Some people, they have money. Some people, they don't have. Some people, they live in good areas of the town. Some people, they live in the slum areas. So now this is a summary of the key differences between rural and urban health. So during your free time, you'll just do what? You'll just go through this table. So what is the impact of access to healthcare on our health or on health outcomes? So the differences in healthcare access between rural and urban areas significantly affect health outcomes. So rural population often face worse health outcome, and urban population, they have better access to healthcare. So this is basically what we've been talking about. So now how can we improve access to healthcare? Number one, telemedicine, like we were talking about yesterday. Number two, mobile health clinics, you know. So mobile clinics that travel to rural communities can help in screening, in health education, expansion of health coverage so that many people are cushioned, and lastly, investing in rural healthcare infrastructure. The government has to ensure that it is investing a lot in building hospital in what? In building hospital in the rural areas. So if the government does that, then you can imagine how dramatically the health conditions of people or the health outcomes of people in rural areas is going to do what? Is going to improve. So that's the end of our lesson. If there is any question, you can ask. So that's the end of our lesson. So you'll be having your next week. This is our last lesson. So in our next lesson, you will be having your quiz, and your quiz will be from module 1, 2, and 3. So that is where you have to focus. So your quiz will be from the first 3 modules, module 1, module 2, and module 3. Then the what? Then the final exam will be module 3, will be module 4, 5, and 6. So that is all about the exams. And also, remember, you also have a research of 10 to 15 pages. So once you finish the research, you can send it to my WhatsApp. Ensure that the research is well written, it has a cover page, well numbered, well formatted, it has the references. That is for you to get some good marks. If it doesn't have that, then you will not get some good marks. So that's the end. We'll meet next week, inshallah. Wassalam.